So after the pandemic, Covid-19, the impact that it's had on our society, there's a big medical conference in Joburg this week. One of the questions is around developments and questions of ethics from the pandemic. Do you remember all of the huge arguments about whether people, you, could be forced to get a Covid-19 vaccination, the issue of mandatory vaccinations? In the end, there's still no ruling from a High Court judge on the question of whether people could be forced to get a vaccination to go into work or a public place. Professor Sylvester Chima is from the Programme of Bio and Research Ethics and Medical Law at the School of Nursing and Public Health at UKZN. Professor Chima, good afternoon to you. It feels like an entire pandemic since we last spoke to you. It's entirely likely that we will have another pandemic like COVID at some point in the future. What lessons do you think we learnt about ethics and about vaccines and ethics from this last pandemic?
Now, ethics generally is about the rights, looking at the right and wrong way of dealing with situations. That's what ethics is all about. And what people are doing at this point in time, whether it's in Europe or in Africa and other parts of the world, is to reevaluate or do a post-mortem to try and find out what things we did right and what we did wrong during the pandemic. Because the pandemic, especially the COVID-19 pandemic, seemed to have caught the world caught us unawares. And then we found out that there were a lot of unpreparedness generally. So what people are looking at is, what did we do right? Well, the most important thing that we did right is that we were able to find out that we have new technologies that can enable us to develop new vaccines at a very rapid rate compared to previously when it took us years and a lot of tests to develop vaccines. So with the COVID-19 pandemic, I think the world was able to realize that, yes, vaccines can be developed quickly and rapidly for different types of diseases that are confronting the world. Now, in terms of preparedness, again, we found out that our public health institutions were not sound in terms of being ready for upsurge of diseases. For example, we had a recent outbreak of Ebola in Uganda, which was, we thought Ebola was, something that was confined to Congo or Central Africa, but it turned out that it can occur at any time and anywhere. And that's why at this point we also have to be careful about being complacent about the COVID-19 pandemic, because we are lucky to be in Africa at this particular point that we are in the middle of going towards summer, warm weather and things like that helping us. But in Europe, they are having an uptick in the numbers, and people are still being affected and dying from it. That's what I can say in summary, yes.
No, sure. There was a massive issue around mandatory vaccinations, and I remember talking to you during the pandemic about it. Has your thinking, or the thinking of people in your field, ethicists thinking around when and how people can be told they must get a vaccination to go into a public place, has that changed over the last 2 years, do you think?
I don't think there has been any change in that sense, but there's been, how will I put it? We're not thinking more about mandatory vaccination because we have been able to actually get numbers without having mandates. For example, if you look at current statistics in South Africa, almost, over 70% of the population age between 60 and above actually are fully vaccinated. The people around 55 to 40 are getting close to that number. Where we have problems are the younger age groups, the 15 to 34-year-olds and the people who are and the 18-year-olds and below, from 12 to 17. That's where we have still hovering around 37%. And I think we can, for example, not necessarily having mandates, but encouraging people, for example, who are about to register for school, to, while they're taking their regular immunization, which you have to take for measles and the trivalent vaccines for mumps, rubella, and things like that are compulsory, it is possible to add, for example, the COVID vaccine to that regimen so that people can actually have it, and therefore will be able to not necessarily have mandates, but we have a situation where people are properly immunized without being forced or being coerced to do so.
We have laws around the vaccination of children, as you point to. If your children are going to go to school in this country and in many countries, you have to have your child vaccinated. Are you surprised that so many adults who were themselves vaccinated as children suddenly didn't want to get vaccinated during COVID. It's a funny thing. In a way, I understand it, because as a child, you're vaccinated, and all the other children are vaccinated, and your parents were vaccinated against it when they were children, so people are used to these vaccinations, whereas the COVID vaccination was new. But it's still odd that people are very happy to let their children get vaccinated at school, suddenly have a problem themselves getting vaccinated against COVID. There's a funny thing about humans there.
Yes, it's not only an African thing. Here we are still, people are still obedient to their laws, yes. But if you look at in America and European situation, people are starting to get second thoughts because of misinformation. Some people are starting to, look at it that it causes some other conditions which are not, scientifically proven. And they have become hesitant. That's part of the vaccine hesitancy that we're talking about. Vaccine hesitancy occurs when people either refuse, are hesitant, or they find ways to try and discourage others from this thing. Most of it is due to misinformation and not understanding scientific progress. One of the things, after thinking about it in recent times, I've thought about it and I've said, one of the things that we have to understand is that we have new technologies. For example, there's been a rapid advancement in medical technology in such a way that we are now able to develop vaccines in, let's say, 1 year or a very short time period, as opposed to what we used to do in those, when we were doing with smallpox and other vaccines, we took 5, 10 years. So people have to be educated, or reoriented in this way to understand that because of the advancement in medical technology, there is possible to actually develop effective vaccines which can be tested and can be used as proven by the COVID-19 pandemic, and therefore people should not be afraid. So there needs to be a reorientation. That's what we talk about, we say ethical nudging, moving people in the right direction by re-educating them so that they understand the implications that if you can, the question you asked me directly, if you can allow your children to go to school and get immunization, now there's no problem and you have been used to measles, rubella, and all those things that are mandatory. Or if you want to travel, you have to get a yellow fever vaccine. Therefore, there should be no reason, for example, why you cannot allow your children to say, okay, while you are at it, why don't you just make sure you get your, COVID booster or your COVID shot if you have not gotten it before? And therefore, it becomes a way of life, just like other normal vaccines are, so that we don't have to force people or have a mandatory situation where people are actually being forced to request or mandated to take the vaccines. I think that's the direction we need to go in ethically and morally about trying to get people to actually comply.
Professor Sylvester Chima, really appreciate the time. Thank you very much indeed. From the Program of Bio and Research Ethics and Medical Law at the School of Medicine and Nursing at the University of KwaZulu-Natal.